Good morning, Stella.
Good morning, Diana.
How are you?
I'm very fine. Very excited to be here.
Oh, thank you very much for accepting to be interviewed today.
Thank you. Thank you very much.
We will already start with the first question. Maybe you can introduce you and your role.
Okay. My name is Stella Luoga. I work as a project manager for Community Health Promotion Fund. I can say I have an excellent academic background in project management with not less than 15 years in a community development project.
Okay, wow.
I can say I'm a very good team player and a communicator, and my best personal values are integrity and authenticity. I strive in my everyday engagement to maintain those values. They help me a lot.
But I know that in your private time you have also some other activities.
Yes, I have some other, do some other activities in fashion and designing. I do a lot of clothes. I make clothes. I make home decoration and office decoration. So that is my other passion apart from community development.
Okay, thank you. And it's a passion that I'm discovering myself also, and I'm sure that we will have some nice time together.
Okay, welcome. I'll be glad to assist and help you develop your skill.
Okay, thank you.
Yeah.
Okay, why did you choose to work for CHPF, which is actually a small no-profit organization supporting students from North Coast Medical Training College?
Yes, I chose to work with CHPF because I thought it would be a good venue for me to develop my leadership and management skills. But the part that I love the most about CHPF, it has clear policies and goals which are community-centered. The project activities, all the engagement that they do are really passionate about helping the community. And that being my passion as well, I thought this is my home. I'm comfortable. Perfect place for me. Yes.
You say that you are the project manager. You are a project manager.
Yes.
And particularly now for the Comundo project for the elderly. Maybe you can explain a little bit more about it.
Okay. The project that I manage is called Health for the Elderly. It's a 2-year project funded by Comundo. It started this year in January, and it's expected to run up to the end of next year, let's say December next year. The objective of the project is to contribute to the improvement of health, especially on the issue of social development, health and physical development of the elderly people who are living within the target area. Those are the elderly who are 60 years and above. Yes, so we are designing some activities which will assist the elderly to access health services on the curative side, and also we have activities which are geared to promote and to bring more prevention activities so that the elderly can enjoy the elderly years, and also the youth and other people can learn on how to take care of the elderly people when the time arrives.
And what is the target area that you were talking about? Where?
We are working with 10 villages. That is the approximate of 12,000 people, all children, men and old people, but the elderly themselves, it's about 900.
Okay.
Yes, so it's a good number, and this being a new project, it has a lot of opportunity, and people are really happy about this project because of the activities that are designed are still very new. The government has not been able to design such activities before, so for us it's a good way because all the activities that we are designing are new, and we are really keen to see how they will prosper and help the community.
Okay, okay. Oh, very interesting.
Yeah, so it's a very interesting and very passionate project. Yeah.
And maybe you can mention one of the activity you have in mind for those elderlies.
For this year, the activities that we are doing, we have started with home-based care because we are working with the Bomani dispensary. It's a public local dispensary. We are establishing system of doing home-based care to the chronically ill elderly. So we have identified few, of which in collaboration with the physician from the dispensary, we have activities. We are still on the designing part to see how we can do activities on palliative care, on nutrition improvement, issues on hygiene, prevention of fall for the elderly at their home. Also, we are working on introducing some groups for the elderly that will be on addressing the social part of intervention, where we'll have activities for socializing and networking. At the same time, we will be giving them health education, health talks, and also have an activity of doing intergenerational activity with young people so that they can come together and have some dialogue on addressing challenges that the old people face.
And is that a moment where also the students of the college will come into the picture?
Yes, in most of the activities, including the home-based care, because the students from North Coast Medical Training College are medical-oriented. So even when we have activities for the home-based care, we will have physicians and nurses to train and give guidance and developing of the program, but through the community health workers and the students. So those are the ones who will do the day-to-day management of the elderly people.
Okay.
Yeah, it's still very new, but we are we are very, very hopeful that it will work because the students themselves are looking forward to have that venue to practice the skills.
Yeah.
So, you know, most of the time they learn theoretically and they have time to go to the dispensary to do the practical part, but at the home-based care, this will be like a big venue for them to go and develop further their geriatric care skills.
Okay.
Yeah.
So with the interview, Stella, you have the opportunity also to bring a message, your personal message to people in Switzerland. What do you want to ask them?
First of all, I will say hi, people in Switzerland. One request for you is, as I've said before, this is a very new project. It's a very new concept in this area. We are trying as much as possible to have activities, and we wish that those activities should last. The project will be for a short period of time, for 2 years, but after that we want the project to be sustainable and to keep on running itself. So for those who are caregivers of the elderly or those who are professionally engaged with designing and conducting activities to do with elderly, we welcome you at CHPF Kenya so that you can share your more ideas on how best we can make this project sustainable so that the community can benefit. And my last message is to the younger generation, because as we know that aging is a process, it's a very beautiful process. We are all one day going to be called elderly people or senior people, so it is our responsibility to make sure that we develop and sustain systems which favor the old people. So even for us ourselves, one day when we get old, we will be able to enjoy these systems that are age-friendly. Thank you, Switzerland.